We're very fortunate to have Robbie with us. He currently serves as the president of APTA Kentucky and vice president of operations at Select Medical. With a doctorate in PT from Regis University and board certification in orthopedics, he brings a wealth of expertise to the healthcare field. He graduated from the University of Louisville School of Physical Therapy in 1996 and is a licensed athletic trainer. As a partner and co-owner of Court PT, he has extensive experience in leadership and clinical practice. His advanced certification in pedorthics from Northwestern University further highlights his commitment to specialized care. Robbie, welcome, and thanks so much for coming.
Yeah, I'm very happy to be here. A lot of excitement going on you guys have here today. I got off the elevators, and the buzz in the room was fantastic. So happy to be part of y'all's podcast. That's great. Thanks for having me.
Awesome. So, Robbie, you've been in the field since 1996, coming up on almost 30 years, which is incredible. How has the landscape of PT evolved over the years, especially as both a clinician and a business owner?
It's a great question. I guess I'm getting, some people call it old. I like to use the term seasoned, right? As a seasoned PT and athletic trainer, but it's a lot of different things have changed over the years, right? Like I think when I first got out of practice, just the ability to just focus on patients, a lot of the administrative burden that really engulfs our clinics and our therapists now, from the whole verification piece to the authorization piece, is just really, it's a burdensome, right? And so you have to spend a component of your day, and it may vary from day to day or from practice to practice, on dealing with insurance companies, right? When I graduated from PT school, there wasn't such thing as Medicare's conditions of environment and care, right? It's like you saw Medicare patients and you took care of them. You didn't have to think about taking this patient on the clock or off the clock, and all the things that our therapists have to think about beyond just patient care is just, it's gotten to the point in our profession, right? And then as you look at where reimbursements have declined, if you look back during the cost of inflation, where it's been over the last 30 years, we've got a 30% pay cut, right? And it's kind of crazy when you think about those things. So the administrative burden, how third-party payers look at physical therapy and not really even looking at the data and evidence of what the value of PT is out there, it's kind of mind-blowing when you think about it. From a clinician standpoint, it's, old school guy. I can remember talking about research on what is the best waveform to penetrate deeper for ultrasound, right? And thinking about that to where our profession has evolved over the course of year, right? As it evolved into clinical prediction rules and the amount of evidence that comes out that gives our clinicians a better determination on, from an assessment standpoint, how to treat patients, is miraculous in how that's improved, right? When I got out of PT school, we used to say it's a gray profession, right? And it still is, right? There's definitely a clinical component that's both art and science, and that's what makes physical therapy such a unique profession to be in, is because it is that mix between hands-on profession, using your hands, using science to make better decisions, is it wrapped around that. But just the evolution of research, I think, has just improved, tremendously to help our clinicians make better decisions and what they're doing with things. So, I think that, as you look at it too, from a landscape standpoint, on just the collaboration that, we have as a profession, I think, whether it's a COVID thing, and I kind of sensed this before there too, but there's a lack of collaboration that occurs. It's kind of, you mentioned my role as APTA president in Kentucky, and it's really nice and unique to really share with other colleagues, right? Whether they're in other outpatient environments, right? And so getting together with them, and we may be competitors on a daily basis. I use that term loosely, but come together for a greater common goal, right? And I think that as physical therapists in our community, we need to have a little bit better intellectual humility, right, with each other somewhat, right? There is, with some of the data, and it varies, only 10 to 15% of patients are accessing physical therapy care for a neuromusculoskeletal condition. And there's a lot of patients out there that need all of our care. And so if we can kind of shift the mindset somewhat to like competitive and beating each other up over who gets patients and thinking more globally, I think we're going to be a better profession to see that. And I think there's an overall sense of change I'm starting to see as people are maybe coming out of COVID and getting that mindset, and some of the national meetings and collaboration pieces that you have, and even bigger companies such as ATI and Confluent and Select PT and some of the other ones out there, right, of working together a little bit more on what does your data say, right, how to make better decisions and things. So hopefully the collaboration can improve to get us to the right spot, right? And if we get to the right spot there, then hopefully things move in direction with regards to payers and things like that. So
love it.
Yeah.
Love it. And then maybe comment a little bit more on, I am biased being a physical therapist, right?
Yeah.
I find it ironic that we have an idea in our heads of it being competitive when, like you said, only 10 to 15% of the population is actually utilizing our services.
Right.
So how do you approach a perceived competitor and say, hey, how do we work on the 75% together?
Yeah.
Instead of the 10 to 15 apart?
No, I think it's a lot of that it's the messaging to your own team, right, your colleagues, right, and getting more inclusive on things, right. And so if you have even just local committees that you can be on as part of the APTA, right, like getting involved with that, and then you learn more, right. The more human nature, right, the more that you're around other people and you get to see where their heart is, what their true character is, right. I think some of that comes out of the way, right. And then don't ever speak bad about a competitor, right. And so we've all been in physician meetings or things, when you're going out trying to get referrals, quote unquote, from physician partners or hospital groups. And, that I've always tried to keep my team to stay away from like this. Don't talk bad about any competitor, right? And so you go into those meetings and they'll say, oh, well, such said this about court physical therapy. You're like, well, it's okay. Yeah, this is how we see it, right? And that's good that they have that perspective.
Yeah.
You see it too, right? It's part of my role as being the chapter president for Kentucky. You're part of the House of Delegates, right? And so you get all this minutia that comes in as we got to stand against POPs, right? Physician-owned PT practices, and we got to stand against hospital outpatient PT practices and what they're trying to do to the private practice people. And we got to stand around and against the big corporations and what they're trying to do, right? So why are we standing against each other, right? Let's just stand with each other and move together on things versus, that's where that intellectual humility piece comes in, right? Their ability to think that you may be wrong, right? Sometimes on things is very important. Ability to revise your viewpoints, to think differently on things. And hopefully we'll get there as a profession with that. So,
switching gears a little bit, you hold 3 pretty intensive roles, and it's quite impressive. Talk to us about what does a day in your life look like balancing these leadership roles? And maybe talk to us, and for folks listening, right, especially owners, and maybe they run a group that has 5 or 10 locations and they want to expand. You're running close to 2,000 locations. What does that take?
Yeah, it's a good question, right? I think first of all, like you got to make sure that you're surrounding yourself with good people, right? Like there's a certain component of what you have. You're only as good, right, is the team that surrounds you, right? And then knowing what your strengths are, right? That's kind of my evolution journey I'm trying to work with as a leader is my own self-awareness, right? And so most of the people that will tell you will say that Robbie likes to throw things up against the wall, right? Like I'm the ideation guy.
Yeah.
I don't know if you're all familiar with Patrick Lencioni at all. So Patrick Lencioni, he wrote The 5 Dysfunctions of a Team, Ideal Team Player. And he wrote a book called Working Genius a couple years ago. So we talk about him so often in court that we had to change his name from Patrick Lencioni to Patricia Lamborghini, right? Because we talk about him so much. But in the Working Genius is so, and we've all probably done like strength finders or Enneagrams, like these are your strengths and what you're going to do. But the Working Genius is a little bit different. And so what the Working Genius says is like these things give you fuel in life, right? And so we talk burnout and things like that. But the more that you have fuel of what you enjoy, and you do that for most of the time, it's going to fuel you and your team in a greater direction, right? And so there's the kind of ideation phase, like creation is like someone that wonders, that like thinks about like, oh, I wonder if this would work, right? And then you got the innovator that says, okay, well, that's the idea. This is how I think we can do it, right? And then you got a discerner, And the discernment guy, he says, all right, this is the direction, this is the decision we're going to go after, listen to the ideation. Then you got to have a galvanizer. So the galvanizer is the guy that says, all right, or gal says, let's go, right? Like it's pumping his chest, the football coach is rah, get you going. It's got to get you, get the team excited. This is the direction we're going to go. And then you got to have the enabler. And the enabler says, hey, I'm going to stand beside you and I'm going to help you get to where you need to. And you got to have the tenacity person, like that kind of closes the loop and the gap on that, right? And so I'm the ID, right? So I'm the invention discernment. That was a long story to where I had to go with things, but so I'm the ID guy. So I know, like, when I'm doing more of that, like I'm gonna get more fuel and purpose throughout my day. Like I can galvanize. That's kind of my work. So you have 2 that's gonna be your work in genius, 2 that's your work in competency, and 2 that's your work in frustration, right? And so mine is invention and discernment. I'm a galvanizer. And somewhat of a wanderer is kind of my working competencies to do things. But like the get stuff across the finish line, like the enablement and the tenacity, like if I had to handhold every single day, right, on things and like to make sure things are, nothing would ever get done, right? And so luckily, surround yourself with people that get that. So like on the APTA side, like Emily Childers, she's our executive director. She is Robbie, you haven't followed up on this, right? And so on our court team, Amy Grizzle, like she's the glue that holds our team together, right? She gets things done. She makes sure every time we had our executive team meeting last Thursday, she has the agenda ready to go. She has everything done. She has the checkoff list. Where are we at on things? And so it's important, right, when you're creating a team, right, and where you're going to go, if you're in private practice and want to grow, like you got to make sure you have the right people on your bus, right, that you have a team set up that's going to get you in the direction of where you need to go. So, and I think that also too, so it's going back to the original question is like, what's the best advice for someone that thinking about expansion, right, and to grow into things like that. So getting that right teams in place and I think you got to think about like, what's your why? Like your why, and it has to be clearly articulated to what it is, right? And so everybody's got to fall in that and believe on that on a daily basis, right? Because there's going to be times when you can't make decisions for everybody, and as long as everybody knows what that why is, you're going to be strong. So that it comes from Simon Sinek. A lot of people have read a lot of his stuff there, right? Like people don't buy what you do, right? They buy why you do it, right? And so there's certainly the how component. But the how gets you to your why, what you're going to do, right? And so, for example, with court, we say we wake up every day with passion to serve others, right? We believe in growing with integrity and teamwork. We're empowered through collaboration, innovation, so our patients and communities will experience the best in rehab, right? So that should give our team impetus on a daily basis of where you're going to go, right? And then I think, once you have that, it's setting out a structure of what's your clarity pieces as an organization to grow, right? And so we base all of our decisions at court off of what we call our 4 pillars, right? So our 4 pillars are operational efficiency, patient experience, employee engagement, and clinical excellence, right? And so if we just focus on operational efficiency and say the patient experience, our roof's going to become weak. Yeah. If we just focus on operational efficiency, our roof's going to collapse, right? And so you got to have a structure and a framework on, all right, all of your strategies and things you're going to do, they're wrapped around our 4 pillars. And then we're deliberate about that too as well, right? And so every fall, we'll have a town hall where we have all of our team leaders, is what we call our clinical directors, to come in, and they'll get feedback from their teams related to what we want to stop, start, or continue off of those 4 pillars. And then we also send out some anonymous survey monkeys on people. People are still like, oh, I'm not sure if it's anonymous or stuff. But let me tell you, some of the things that they tell you on the surveys, they're obviously anonymous, right? But that's okay, right? Like it's, I tell my team is like, good ideas have no rank, right? And so as a leader, you got to be able to take those gut punches, right? And that's a tough transition, right? As you go from a single clinic or maybe a couple clinics to where you're the guy that's in the business. Like your people are coming to see you because of you, right? And you've got to let go of that a little bit. And you got to get that radical candor feedback. Like it's important. Like you want people around you to be kind, not nice, right? And so being nice is just telling somebody what they want to hear, or being kind is what they need to hear, right? And so you got to have a team that's wrapped around being kind versus nice. And so we get that idea. And so we'll use those ideas. We'll get, this past fall, we spent 3 days off site, probably a stack of 2 inches thick of comments that we ran through around our 4 pillars to develop our strategic plan. And then we roll that out, and we just rolled it out in January and February to our team. And that kind of comes our strategic plan as we go forward throughout the year. And luckily we have Amy Grizzle every time we have a meeting to make sure that we're staying on task with what our plan is and the strategies that we come up with, right? There's always going to be a squirrel, or you change gears, you didn't think about, what you're going to do. And there's always those moments, right? It's being any effective business, but having that business plan, I think, is an important piece to do. And then I think the other thing we talked about, just kind of a final thought on is just like how you use data, right? So we talk about how things have advanced and so forth, but using data to make better decisions, right? And that's somewhat of a weakness in physical therapy. Like, I know that I provide better care one-on-one. Okay, well, what do you? What does the data say, right? Or I know that if I do have someone that comes in low back pain and I see them today, they can do their home exercise and come back in 2 weeks and they'll be better. Okay, is that so? Is that what the data says, right? Yeah. And so using some of that data, that's one of the great things about our partnership that we have with Select Medical, where they're our majority partner, is we get a good look in. They have a very robust, strong outcomes department, some very sharp people leading that department. And so, like, for example, this past year, we've crunching all the data, they said one of the key determinants that whether someone is going to not drop out of PT, right? So that's a big problem within our industry, is people don't complete their actual plan of care that the physical therapist sets out with them, is what does it look like between visit 1 and visit 2 from a duration standpoint? And so if you do a follow-up visit with someone within 3 days of their initial eval, that's the best opportunity for them to not drop out of therapy, right? Mm-hmm. Then you go 5 days. If you go 6 days or greater, it actually becomes a cliff, right? Where the patient will drop out. And this is crunching, right? All diagnoses, surgical, non-surgical, and those pieces, looking at that. But it's pretty interesting data, right? And so getting yourself and looking at hands-on on that kind of data to make better decisions as you want to grow your business helps. And then it also helps out with your why, right? As you're trying to articulate to your therapist on, all right, this is why you want to see so many patients a day, or right, this is why we're going to go ahead and get that second visit scheduled before they even come in for their first visit, because we know that gives them an opportunity to have the best possible outcome, higher net promoter score, not drop out of therapy. Yeah.
Love it. Love it. Quick follow-up on that. Something that, as we continue to scale here, you grow a lot, you add a lot of team members, a lot of leadership. Like you said, there's a ton of locations across the country now. How do you avoid like decision fatigue? With that many people involved, at the scale you guys are at now, how do you avoid too many voices at the table for every decision that needs to be made and still stay efficient with those key decisions?
No, I think it's good. I think, of course, I don't mind making decisions because that's part of my work as genius, right? Decision maker. But no, it's finding the right who's, right? And so there's a good book, Who Not How, out there. And so having the right who is important to do, right? And then you've got to trust as a leader, right? You've got to delegate and trust, right? So you don't need to abdicate, right? So the key difference, right? When you abdicate as a leader, I would say, okay, Greg, like, I want you to take this on, but there's no follow-up, right? You don't follow up. You just abdicated that because you didn't want to deal with it, right? And so the key component of a leader is making sure that you delegate, but that there's a collaboration going forward. Like, I trust you. I want you to have, the autonomy to figure this out. We'll work together on it. So I'll delegate this to you. So delegating more, right, to people, I think is a very important piece to think about. Yeah.
One thing that I think about a lot, and one thing that we've seen in our business is we take a lot of folks who maybe are earlier in their career, but are really hungry, that want it, that, we think can figure it out, and we give them the opportunity to go do it. Right?
Yeah.
Because I think that the want to go do something is going to beat a lot of experience or a lot of, just being in the space for a long time. Oftentimes the want just beats it, right? And so one thing that we've seen, especially for decision making, is give it to people that are hungry, that'll follow up, and that'll see it through, right? And have folks like you just mentioned on the team that can. That you can rely on and trust on. Yeah. Trust to.
Yeah. That's great. Great, Hirsch. That's great insight too. And we, we talk about too, because this is another Patricia Lamborghini thing in the ideal team player, which is I really like, because I'm a simple guy. So all his books are in fables, right?
Sure.
So you'd say it's easy to understand and things.
Yeah.
So, but he talks about in the ideal team player being, humble, hungry, and smart, right? So you're checking off a lot of boxes there, and you look to. And we actually use his questions when we're interviewing therapists, and we tweak them a little bit, but just that's who we want to have on our team, right? At court, is we want people that are humble, right? Have a high emotional IQ, right? And then hungry, right? And then the smart is more that EQ piece, right?
Yeah.
Like intellectual humility, EQ, self-awareness. So that's good. That's fun. Did you bring that up? Yeah, I agree.
Similar to, I think recruiting a team is to your point, I think is the most important part of building any business, right?
Right. Yeah.
Now, if we look at in the last couple of years, there's been a rising trend of burnout across providers, across a lot of different specialties, right?
Yep.
I think coming out of COVID and working a lot of hours, getting burnt out on documentation, it's not an easy job. So I guess two questions. As someone who leads APTA Kentucky, what's your take on how this is impacting therapists in your region, in your area? And then can you talk a little bit about how you think about recruiting and retaining top talent?
Yeah.
For folks that want to, back to the initial theme of grow their business.
Yeah.
What are some techniques you've seen there?
It's good. I'm actually, I think I'm ready for your first question pretty well. I've actually, as part of my role as APTA Kentucky president, we had our student SIG. We had two great young ladies that are going to be dynamic physical therapists, Anna and Sarah. They actually interviewed me for one of their courses, and it was funny when they emailed me an interview. They said they had to interview 3 therapists, and they needed someone that had been practicing 0 to 5 years, and someone 5 to 25 years, someone 25 years plus. I don't know how they thought I was 25 years plus, but I guess I must look. I get too much gray in my beard and in my hair, receding hairline. But anyway, so they asked me that same question too. It's interesting on that, and it's like, I think there's a component of like, sometimes it gets back to we shoot ourselves in the foot sometimes, right? And they talked about burnout, and I said, well, just tell me a little bit more, like, how are you learning about school? Oh, we have this class in school. So as part of PT school, they actually have a burnout class, and they're learning about how to cope with burnout. And it's like, so it's like, sometimes like, do we, it's like the more you talk to your kids about not drinking, right? The more they're going to probably sneak out and drink. Okay. Right. To do things. It's like kind of the same thing. Like, cause the more we try to like bring it up sometimes, do people like, oh, I don't know. Should I feel burnout? I don't know if I need to feel burnout. Like, it's kind of crazy. But ultimately I told them, like, and we talk about this as a team too. Right. And so I think it kind of goes back to, the 3 things that all human beings want. So all 3 human beings, if you think about it, is they want a level of autonomy, right? Their own fruition to make decisions, right? In their best interests, the best interests of their family, and the direction they think things should go, right? We want to be related, right? You want to work with a team that you feel related to, like you're on the same mission, like the same clarity piece, right? And you want to be competent, right? And so if you think about those 3 things, I think most of the time I've had a conversation with someone that tells me that they feel burnout. And even when I've felt it myself, right? We all go through periods like, oh my gosh, I'm gonna make this through the day. Like I had about probably, right before Thanksgiving, like I was up to this and like all the operational things I was doing. And I told one of our team leaders at market manager in court, I'm like, just clear my schedule. I just want to do evaluations today. I just need to connect back to see patients, right? To bring me back to where I was. Because I had, since stepped in this role 2 years ago, I've seen patients. My living room sometimes is a walk-in clinic, right, where people come and friends to see me. But actually seeing patients in the clinic, not so much. And so, but when you get back, you look at those 3 things. Like, what is that level that you're struggling with, right? And asking deeper questions. And I think that's kind of our role as leaders, is to ask deeper questions on that. It's like, what is that? So tell me a little bit more about that, right? Asking what and how questions are important, right? A lot of times when we ask why questions, it's like your mom telling you, like, why isn't your room clean, right? It brings us back to our kiddo days and like do that. So asking good questions and diving in deeper, right? And so is it a related piece? Like, do the people that working together in a specific clinic, like they don't feel like they're related, or there's friction within that team for whatever reason, right? Is there somebody that's kind of the naysayer, right? Or the cynic in there that's kind of pulling the rest of the team down? Or are we as leaders within court not giving our teams enough autonomy to make decisions in the best interest that they need to for their patients, right? And maybe we're going a little bit overboard, right? I've talked about data early and the importance of it, but are we going overboard with it, right? And how we're using that data to guide those questions? Or do they feel competent, right? Like competence is a huge component, right? When Greg, you know this is a P2 as well. Like when you get out of school, right, you got that imposter syndrome sometimes, and you don't feel competent in what you're doing. And so like the more that you can feel competent, right, and what are the resources you're providing that PT, and what, maybe it's one thing they're struggling with, maybe it's everything, maybe it's documentation, right? Or there's a company named Athelis could maybe help out with that. I don't know, but it's all those pieces that you got to look at and to what that individual person needs, and to meet them at that level, I think is important, you know. And so if we look more deeper down to that, I think that would be more helpful. So, and I think that's a key component, right? Definitely of the retainment piece too, as well, right? When you look at, how you're handling people and how you're having conversations. Are you having regular one-on-one conversations, right? What's the structure to where, our team leaders are meeting with their clinicians on a monthly basis, right? Even if it's just a 15, 30-minute check-in, right? Are they sitting down once a quarter and having formal discussions on, stay interview, we call stay interview questions once a quarter, or career investment discussions, or like, how are they doing, right? Checking in with them is an important component of what that is to retainment, and looking at that. I think it's an important part of where you're going, from a recruitment standpoint. I think that was your second part of the question, right? Recruitment is, I think the best way for PTs to recruit themselves is just providing a good student experience, right? And when you provide a good student experience, you're going to get top students that want to come to your clinics and do rotations, right? And so we all know that an interview process is a very unreliable predictor of how well that person's going to match within your team and their future success is going to be. And so what a great opportunity, right? Depending on the length of a rotation, whether it's 8 weeks or 12 weeks, that student gets to, not only get to learn about the student, but the student gets to learn about you, right? Like maybe that's not the place they want to be too as well. And so I think it's a great opportunity to do that. And so we spend a lot of time really looking at our student programs and our CIs and how well our CIs are trained, and offering our students some things that they may not get on other rotations to do that as well. We've got a lot of therapists within court that are adjunct faculty at Bellarmine University in Louisville, Kentucky, UK in Lexington, and some others doing some things at Western Kentucky University, right? And so they're collaborating with students, and the students know that they're there, right, doing those things. And then, I think it's important too, everybody comes out of school so they want to have mentorship, right? And so what is mentorship? It's like driving a car. Well, I mean, you could drive a 30-year-old Kia, right? Or you can drive a Corvette CXR, right? Like those are two different things, but they're both cars, right? And so mentorships are the same thing. And so having a structured mentorship program to do, one of the lucky things we have within court, we have a physical therapist that's fantastic named Matt Lee. And Matt, and with help with some others, put together what's called our Clinical Excellence Academy. So it's a year-long process to where we leverage MedBridge for didactic work, and then we do once a month we do it's a hands-on half day during clinical time, hands-on lab, right? And so the first 3 months are working on those soft skills that are so important to be a physical therapist, especially out of PT school, and then it's neck, shoulder, knee, all the way down kind of thing over the course of 12 months, right? It gives a bit of a structured component of what that looks like, right, from a mentorship program, right? And then augmented, we have residency programs. We have a geriatric residency program, orthopedic residency program. We have a hand therapy residency program. We have COMT program that we do. And so making sure we're providing opportunities, right, kind of goes back to that clinical excellence pillar, right, and how that matches with things on what you're doing to make sure we're growing as a team, right? And so when you're growing as a team, right, that's going to be attractive, I would think, to the best, right, to do that, to be able to provide those type of things. So those are some of the big things we do. I
love it. I think you hit on most of the areas, if not all, that have come to mind, right, when I've practiced. Right, like what do they want coming out of school, these new students, these new grads? And what does lead to that burnout, or even though it's a bit of a buzzword right now, like you said, I agree with you 100%.
Yeah.
Question two, maybe just to follow up on that, is from a progression standpoint. I think one of the big things that I felt, and I think that I hear a lot from providers as we talk to them about coming to work with us at Athelis, is the ability to continue to grow and progress in a position or with a company outside of just, hey, I got a certification, or I got a raise to match the cost of living. Like, is there the ability to continue to progress without a perceived ceiling?
Yeah.
And is there a way that you guys have tried to approach that subject with these?
I mean, if I'm sitting here in this row, pretty much anybody can progress to where they want to be, right? Like, if I can get here to where I am, then it's pretty low hanging fruit. Like, people can get there pretty easily on things. So, it's a great question. And so sometimes too, like we think of leadership as a position, right? Like as a destination, right? Or I'm advancing to a destination, right? And so I get inspired by people. Like, we got a clinician that's been with us as long as I have, almost 30 years, named Chad Garvey. And so Chad Garvey has done different positions with us. He's helped lead our orthopedic residency program. He's been a team leader, but he just gets great joy out of taking care of patients every single day. Like, and so he's pulled back from all the administrative stuff and just like, I just want to laser focus and take great care of patients. And so we have a, we reward our, this is kind of maybe an answer to your question too, as well as but as clinicians invest in their clinical skills, we have it's called our CASE program, Court Academy of Clinical Excellence. And so as they invest in themselves and they go through so much continuing education credit, CEUs, and then as they advance and get some certifications, right, they get a step, right, to get a virtuoso, what we call virtuoso, where they can potentially over a 5-year period get a $10,000 increase on what they're making just by themselves growing clinically, right? So we're going to pay for all the clinical excellence stuff that you're going to do. And then if you do it, you're going to make $10,000 more, right? And so, but we started this year, we put it out there as a BHAG, big, hairy, audacious go for somebody to say, all right, you're going to be a court legend. Like, you had to have like double the amount of points and had to practice at least 15, 20 years. And like, Chad already had all the points and everything else. So he's our first legend there. So, but I think that there's that component there, right? But then it goes back to, as a leader, like invest, like, where does someone want to go with their practice, right? And where it needs to be. And sometimes, the best thing you can do as a leader is like, if you can't meet where they want to go, right, is having enough fortitude is like, Greg, like, you got a good opportunity here. I think you should take it to do something else and to look at that, right? There's always opportunity. We have opportunities, like, we want to continue to grow and all the things that we're doing where people can step into those team leader roles. And we looked at that too from a couple years ago. We had we call market managers. We have people that within the team too that are leading programs, like leading our sports medicine program, or leading our pelvic health program, or leading our vital cancer program, or our vestibular program, or our we call our power, which is our personalized orthopedic weight loss reduction program. And so like opportunities. And so the more that you can really listen to some people, like what is it their passion is to do and get there. We had Elliot Manley, who was he's the galvanizer on the team, by the way. He talked about that earlier. And he when he first came with us, he loved running. So he developed these running clubs, right, and doing those things. And so giving people in a direction through listening to them to where they want to go, right, to bring that intrinsic motivation, right? There's pay and things you can do extrinsically, right? But then intrinsic motivation that helps really get your people on the right bus and where they want to be, I think is more important as a leader sometimes.
Love that.
Yeah. So.
Similar to that, we spoke about this about 10, 15 minutes back. CMS has been consistently cutting rates. And you said it, right? With inflation and CMS cutting, you're making 30% less, right, over the years.
It's crazy.
How do you think about protecting your margins, right? Because any business owner, right, to keep the doors open, you have to protect your margins, right? And I want to hear how you think about it, right? And of course, it differs by region to region to region, right, in terms of reimbursement. And our take here is that you have to fight fire with fire.
That's right.
Right? You can't do the same things that were done 5 or 10 years ago and expect to make the same margin if your reimbursement's down 30%.
That's right.
Right?
Yeah.
So want to see how you think about that.
No, and that's, a lot that I'm learning more about the Theolis things like that. You're on the right mindset. You're on the right track of where that's going. it's interesting, even if you look, and so Court is a part of Select Medical and a lot of strengths, and this is PTs in general, not just like companies like Select Medicals. We operate like it's mom and pa's physical therapy in 1985, right? We have a front desk person that has to have a smile on his or her face every single day and greet the patients and get them scheduled and do their verification and do their authorizations. And some practices have them doing the billing, and right, it's like all the things that we ask someone to do on things is like we talked about at the very beginning of the podcast, like it's changed, right? Like you didn't have to fight back in the day with the Carolines and the Coheres and all the third-party administrators that you deal with to try to get off on things, right? They have to fight for because you missed this and this on your claim. It didn't go through perfectly, or the insurer is partial paying you versus full paying you, hoping that you don't catch it, and all those type of things. And so we've got to kind of continue to think differently, right? And how we can leverage and use technology to help, right? And not only is that going to help out with our margins, but it's going to help to the purpose of the burnout too, right? Like you think about the competence piece, right? And you have somebody that, didn't really go to any kind of training to do any of that type of things with the verification, authorization. And they come in and you try to teach it to them in 1 to 3 weeks on what they're supposed to do, right? That level of competence is not there. And so if you can get an agent or an AI that can do it for you, right? That allows them what they want to do, right? Because most of those people you hire for your front desk, they love people, right? And they want to relate to people. They want to smile. They want to answer the phones. And honey, in the South in Kentucky, honey, I'm gonna get you scheduled. It's gonna be fine. We're gonna take care of you. Yeah. Greg, he's a great therapist, and he's gonna make sure your low back is just fine. Honey, right? And so that's where we need to get to, right? And with that component of there, from decreasing that administrative burden, right? On the revenue side, things is at least some of the things we're looking and thinking about is self-insured employers, right? When you're self-insured, you direct kind of how your pay goes, right? The claims came out directly out of your pocketbook on things. And so there's an increased emphasis that employers are noticing that, hey, if we invest in physical therapy, right, there is a true savings, right? When someone has PT first, right, the value PT study articulated it very well. And there's other studies out there when someone sees a PT first versus going to a primary care physician or specialist, they have a 1% chance, right? I think that number goes up to 6 or 9% when they see a specialist for surgery, right? And so getting to the right spot at the right time is more important. So when you can go to an employer and say, hey, we can save you dollars, and then on top of that, there's no copay, coinsurance for the employee on things. And so there's not a reason for them to drop out of therapy from a high copay or coinsurance standpoint. It's a win-win for the employer. Like they save significant amount of dollars. So that's something we're starting to think about a little bit more.
I like it.
Is that how we're partnering with work comp carriers in Kentucky and Indiana, where we're located, work comp's very payer. And then having conversations like we've had, myself as part of my role with APTA Kentucky, and I always got to remind myself when I'm having conversations with Anthem, which hat I have on with them, right? Whether I'm president of court or president of APTA Kentucky. But we've had some very productive conversations with Anthem and what maybe value-based care looks like. And so hopefully we can continue with those conversations there. I'm going to put a lot of weight on RFK to make America healthy, great, and make sure he realizes what physical therapy is as a benefit to things. So we'll see.
It's interesting you brought up the workers' comp point. As we learn more and more about workers' comp, it's one of the industries that it just feels like it lives in the 1980s, right?
It's so bad, yeah.
It's sometimes you don't have electronic connection. You have to mail it. You get a response 2 months back.
Yeah.
We've seen if you get denied, sometimes they don't even tell you you're denied. In fact, a no response means you're denied. Yeah. Right. And so that's been one of the biggest challenges for us is how do you build a robust technology solution with a counterparty that is fully running on paper still, right? And I think what you're saying is resonating with me there, because we got to get everything to the 21st century, right? We really have to accelerate everything. I know. To make sure we have the best quality of care and reduce these administrative costs, right? Yeah. That's where the bloat is at the end of the day.
It's a unique system too, as well. Like if you look at it, there's who's the carrier, who's the TPA that's involved with them, and then you got MedRisk and one call the TPAs, and how can you collaborate with them to have decrease some of those deficits, right? Or, like in Indiana, we were talking about our home health agency we have in Southern Indiana. And
Right.
I was talking to my executive director this morning, and we signed, I think I get it 5 times a week. I'll get sign a single payer case agreement with the work comp carrier for home health in Indiana. And you sign them, and you sign it, and they pay you 30, 40% of what you signed for. Like, what's going on here, right?
Yeah.
It's like, it's archaic on how they kind of handle things. So,
yeah, on that point, say you were starting your own practice today, right? And you're new to the space, you'd been a therapist for a while, but you wanted to take the jump into ownership, right? What is the best investment a private practice owner could make today to future-proof their clinic?
Yeah. I think a lot of it goes to what we talked about earlier, like thinking about like who's going to be on your team, like what's your mission, like what's your why, right? Even greater than what your mission is, like what that means to you. Thinking about surrounding yourself with people that can make it be bigger, right? So most private practice owners, a lot of great clinicians out there that do fantastic work and care. But as I talk to some people in the past, like, give me some examples. And it's that most of the time it's about them having a tough time of getting their hands out of in the business, right? Yeah. Just working on the business all the time, right? So you got to work on the business, not necessarily in the business. And so changing that mindset and filtering that out, I think is important. And then looking at too of like having the mindset of like, you got to grow and think about like what collaboration looks like more, right? And what that is. And so whether it is with in a specific employer in your area, right? Maybe it starts out with work comp and things such as like early symptom intervention or doing post-offer employment testing and establishing a connection to where the time that you're investing with every single patient for direct access is tremendous, right? That's your best marketing, hands down, that you can do. Is just word of mouth from patients, right? And going back and being a raving fan to their physicians and what that looks like. Investing time in your communities, especially when you're in a smaller community like where I live in Bardstown, right? Bourbon capital of the world. Shout out to Bardstown, by the way. But just like being invested in your community, right? And doing that is an important component of doing that. And then I think too, it is, as you grow, right? And you want to try to grow, right? Maybe it's 20 clinics and you're going to grow it to bigger than that, is instilling a sense of ownership within your team, right? And it's an important component, especially if ownership per se is not there, right? And so there is the tangible piece of equity, right? And so a lot of PTs want to have that tangible piece of equity within a clinic that wants to keep them tied into there. But there's really so much right opportunity and cheese that can be spread with that, but creating ownership on that, right? And so I always kind of think about Chick-fil-A, right? Like I think if we all would raise our hands here and say, who would rather go to Taco Bell or McDonald's or Chick-fil-A? I think we would all raise our hands to say Chick-fil-A, right? Now, I'm Catholic. On Fridays in Lent, I do love a filet of fish, chocolate milkshake and fries, so I may pick one up. But more than that, right? Other than on Sunday, we can't have Chick-fil-A. People pick Chick-fil-A. But you look at Truett Cathy, like and how he started their business. And so when you're an owner-operator at Chick-fil-A, you don't own anything. Like you're McDonald's, like you're a franchise owner, you have equity ownership in that, right? Or talk about whatever that is. You're an equity owner of a Wendy's. But at Chick-fil-A, you don't, right? You get a portion of the proceeds, right, that flow through as a cash flow every year there. But I can't remember the exact time, but I think it's like 20 or 25 years. You have to sunset as the owner operator. And it goes on to somebody else, right? So you're just a steward of that ownership for a piece of time, right? And so instilling that steward ownership within your team and their opportunities to where you can really work intrinsically and extrinsically to develop things for your team to take ownership, I think is a very important piece to kind of grow that, right? To go from that 20 to that 2,000 piece to kind of take that off the level. And then without a doubt, the most important people that you need to have on there is what we call them our team leaders. Some people call them clinic directors, call them center managers, potato out there, right? But we say all the time, like our team leaders, they got the toughest role within the clinics, right? Because you got to be a translator, right? You got to effectively translate to your team. They got to be able to translate to people like myself. You got to be a leader, right? You got to stand up, be a leader. You got to be a leader both for what they need wrapped around that arc theory that we talked about, right? But also as a player, right? Because you're a player, like you're a clinic director and their team leader, like you're seeing patients every single day. You're like the kind of Pete Rose coach, player coach back in the day, right? And then you're the coach too, as well, right? So you got to be a coach as well. And so making sure that you get the right people on the bus for that position, I think is important. Important things to think about.
Love that.
In the row. Yeah.
So one more question to follow up on that is, it's becoming like a more common trend now, to, if we have these new grads experiencing burnout, to try to start their own practice. And that's not necessarily always a bad thing.
Yeah.
But there's also a profile of, character and background and business sense, et cetera. Like you said, they can be a great provider, but can they be a great business owner? And so maybe comment on that. Like, do you have advice for people out there? What questions should they ask themselves if they were looking to start their own practice, if they would be a good fit or not? Right.
So if they want to start their own practice because of burnout, okay, then they just need to ask themselves, right? Like, what's the story you're telling in your head? Like, so not the book quote or anything, but Craig Groeschel, he's got a great podcast. He wrote a book called Winning the War in Your Mind, right? And it's kind of helped me to think a little bit differently on some things too as well. Like, what's the story that you're telling yourself, right? Because your why starts really with your experiences and your thoughts, right? And then, so your experience and thoughts become your why, right? Your why becomes your actions, right? And your actions become your results, like what you do, right? And so if you are leaving something because you feel like that you're working too much, right? And you feel like you're doing that, well, you're doing the wrong thing by getting back in the practice. All right, let me tell you right there, right? If you're very upset with how you're getting treated, you don't feel like whoever it is that you're working for, like you don't have that autonomous piece, you don't feel related, right, or competent, whatever that is, then try to mine through it and to find out where that is, right? If you want to be that humble, hungry, smart guy, right, there's great opportunities to get into private practice today, right, and to do that and to be very successful. But you're going to have that mindset that you're going to have to work a lot, right, to do that. Some of the other things I hear too is people will say, well, I want to open a private practice, but I'm just going to do cash base because that's going to be less work. Oh, well, maybe not, right? And so, yes, your rate you're going to get paid per hire is very good, but if you don't have the business acumen, and how are you going to handle that patient that, and when you're only going to see one patient an hour, right? And then all of a sudden, half your schedule collapses, you only see 4 patients that day, right? And you got to make payroll for your front desk and whoever's doing your billing and all those pieces there, right? So being able to have that business acumen is very important, whether you're going to be in a traditional outpatient setting, you're going to be in a cash-based type of setting. Like, you got to think about all those things and really develop a business plan before you kind of launch into it. And make sure to, I think is, a lot of times in life, like, we run away from stuff instead of running to something. Like, you should go into private practice because you're running to something, not that you're running away from something. Right?
Yeah, love that.
Yeah.
Love that. That resonates a lot. And I think to your point, just again, maybe just commenting on that last part is, you see people running away from things thinking they're going to find something bigger or better. The grass is always greener.
Yeah.
And the same problem set that they had experienced in their previous situations for some reason follows them into their next steps if they don't do it for the right reasons.
Yeah.
So,
well, in the South, I always say the grass is greener on the other side. A lot of horse, what over there. So, right. But,
love that.
Awesome. So I want to move to a segment in this chat just about extra hours in the day. So I have 2 questions here. The first one is, if you had an extra hour in your day every day, what would you do?
Great question. I don't know. For a natural born ADD, I don't know what I would do with an extra hour. But a couple things come to mind. I think that I would spend more time taking an opportunity to express gratitude, right? And so expressing gratitude to great people that I work with family and friends, and just letting them know how important they are in my life and what they're doing with their purpose in their own lives, right? And so I think expressing gratitude is something I would take more opportunity to do, and kind of that piece too as well. I wish that I had a little bit more time within the day sometimes just to kind of close the loop, right? The people that reached out to me, whether through a text or a phone call or an important email that sometimes I don't get to the next day, or maybe it's 2 days out, right? So be able to just to close the loop a little bit better, and maybe that's part of my ADD mind. I need to come up with a better system on how to close that loop a little bit with some people would be important. And then probably the third component too is working out a little bit, have more time to work out. Yeah. So I've done a pretty good job over the last few years of working out, but it would be nice to have just a solid hour that I could say, all right, 5 days a week, I'm gonna work out. So
Yeah, I think my answer would be the same as yours. The last one, where I would like to be more regular with working out, and it has so many benefits. Right?
It just clears my mind. I think so much better. I have to work out in the morning. If I don't work out in the morning, then forget about it. It's not important. But part of the reason why I work out in the morning is because it's like clears my mind. Like I put on my gangster rap and like, I would like a 54-year-old from Barstown, Kentucky, having gangster rap. I was just like, I don't think about anything, and I just like just work out, and it's a good moment to do. So
that's awesome. That's awesome. And then the second question I have here is, if you or your staff didn't have to deal with insurance, with hours of documentation, with labor-intensive admin tasks, how would the quality of life change for your amazing team that you just spoke about?
Yeah. Well, I mean, I think it's a great question. I think it's the whole full circle of this conversation we've had today, right? Because it gets it back to where it was in 1996 when I got out of PT school, where it was just, we could just focus on patients, right? And each other. And I don't know if that's part of what's leading to, the quote unquote perceived burnout or feelings of burnout. There is all the extra stuff and administrative burden and the documentation requirements. Like, it was so easy. I had a dictaphone. I could probably recite to you what I did, but it would take me literally no more than a minute or maybe 2 minutes to dictate an eval, right? And we had a plan of care flow sheet, right, and treatment sheet that we kept up with every day. Like, it was so easy, right? We didn't have to call insurance for authorization and benefits. And like, I told people, like, and some people think I'm crazy. Like, when I got out of school, like I treated every day. We treated 15, 18, sometimes 20 patients a day, provide them great care, but I didn't have to worry about all the documentation and sit there in front of my computer and make sure that was done. Like, I could literally keep eyeballs on 2 patients, sometimes 3 patients, and provide great care. Yeah. And I know it's great care because I'm now seeing their kids in practice, right? And things like that, coming back for things that they know, right? To kind of come back as you get old in PT practice, seeing that kind of circle of life come through. But no, being able to provide that for our industry, for our therapists, and getting to where they can just hammer down and focus on patient care and let innovation take over, right? Because that's is an important component, I think, of where we need to go as a profession. It would be fantastic.
Absolutely. Anything else top of mind for you? Anything else you think worth chatting about?
Well, I'm super excited that my Louisville Cardinals are back in the NCAA tournament. Here we talk about that. So after a 5-6 year hiatus, and so Pat Kelsey's done a fantastic job getting that program. So it's good to have Louisville basketball back. Although I'm a little disappointed. I think they ranked 13th in the country, and they got an 8 seed. I don't know what that's all about, selection committee on there. So if you look at the historical data over the last 15 years, the number 13th ranked team in the country, the highest seed that they received was a 4 seed. So with an average of a 3 seed. So I don't know. But anyway, we'll fight through it. Hopefully we can beat Creighton. And if we're lucky enough to beat Creighton, we can shock and awe Auburn.
I love it.
So
anyway. Well, I just wanted to interject and say I love your answer about expressing gratitude daily.
Yeah.
I think that's just so powerful. And there's actually a lot of evidence on that shows gratitude is one of the most powerful tools for mental health out there.
Right.
And we just want to express our gratitude to you. I mean, come all the way out here to sit with us, spend time with us, to learn from you has been very, very, very inspiring. So thank you so much for being willing to spend time with us today. We really appreciate it.
I set the bar low, so hopefully it'll be better.
No. This was incredible. Thanks so much for the time.
Yeah. Awesome, guys. Appreciate it.
Awesome.